Good afternoon, ladies and gentlemen. My name is Nikita. I am a research assistant at the Leadership Institute for Global Health Transformation here at the NUS Swee School of Public Health. I focus on health system strengthening and digital health research in Asia. And it is my pleasure to be your MC for today's dialogue. Now, a few housekeeping announcements. First, please ensure your mobile phone is set to silent, and please refrain from consuming food inside the lecture theater. Second, please note that we will be conducting photography throughout the event, and this event is currently being video recorded. Please note that mask wearing is optional, but strongly encouraged if you are feeling unwell. Next, in case of a fire emergency, please do not rush down from the staircase as the steps are narrow, and do not leave your valuables unattended. Do keep calm and do take note of where the exit points are, at the front and back of the auditorium. Please follow the escape route, which is currently shown on the screen. You may follow our ushers in an orderly manner and assemble at the multipurpose field. For guests who would like to connect to NUS Wi-Fi, please follow these steps. Feel free to take a photo of this slide in case you need to refer to the steps later. And finally, for today's Q&A session after the panel discussion, we'll be using Pigeonhole, where you can submit your questions. To participate, please scan the QR code that is currently shown on the screen. Alternatively, launch your internet browser on your mobile device and enter www.pigeonhole.at into the address bar. Thereafter, key in our event passcode, AF5X58, as shown on the screen. There's also a voting feature, so questions with the highest number of votes will be highlighted to the speakers and stand a better chance at being answered by them. Alternatively, should you prefer to raise your questions directly to the speakers, there are microphones positioned along the steps. Minister for COVID-19, Research, Science and Innovation, Seniors and Associate Minister for Health, New Zealand, the Honourable Dr. Ayesha Verrall. Dean, NUS Swee School of Public Health, Professor Hsien-Hsien. Distinguished guests, colleagues, and friends. A very good afternoon, and kia ora, or to have life and be healthy, as our friends in New Zealand would say. A very warm welcome to the Public Health Thought Leadership Dialogue, presented by the Swee School of Public Health. The tobacco epidemic is one of the biggest public threats the world has ever faced, killing more than 8 million people a year, including around 1.2 million deaths from exposure to secondhand smoke. The economic costs are devastating. Clearly, it cannot be business as usual if we are serious about paving the way to a tobacco-free generation for our youth and children. Drastic times call for drastic measures. New Zealand is at the forefront, proposing bold new tobacco control measures with their Smokefree Aotearoa 2025 action plan launched last year. With that, we very much look forward to hearing from today's guest speaker, Minister for COVID-19, Research, Science and Innovation, Seniors and Associate Minister for Health, New Zealand, the Honourable Dr. Ayesha Verrall, on creating a smoke-free future. And I'm sure thereafter, an engaging and robust panel discussion with our distinguished experts, no less. I would now like to invite the Dean of Swee School of Public Health, Professor Hsien-Hsien, to say a few words and introduce our distinguished speaker. Prof. Teo, please.
Minister for COVID-19 Research, Science and Innovation, and Associate Minister for Health, New Zealand. Acting High Commissioner Peter Kemp, New Zealand High Commission. Distinguished guests, ladies and gentlemen. So I thought maybe I would start off with a very warm welcome back to Singapore, Minister, since we know that you're certainly no stranger to Singapore, NUS or NUHS. And I'm delighted that the COVID-19 situation worldwide has subsided to the level that borders between Singapore, New Zealand, and many countries are now open for business and tourism travel. For us to be able to convene in person, the Public Health Thought Leadership Dialogue, which is actually the apex platform that we reserve for convening the foremost thought leaders in public health. So for the past 2.5 years, Singapore and New Zealand witnessed the devastation of COVID-19, the lives of many people locally and worldwide, to job losses and failed economies. Family and friends grieve over the loss of loved ones. And as the world gradually recovers from COVID-19 and we start to look back at the lessons that COVID has taught us, there's one lesson that is especially relevant to our topic for today. And that is that the world can no longer treat infectious diseases such as COVID, dengue, or influenza as separate from non-communicable diseases such as diabetes, hypertension, stroke, and cancers. Now, after all, when we start to think back about COVID-19 and ask ourselves, who were the ones that bore the greatest impact of a COVID-19 infection, the ones that were most at risk of severe disease and death, these are actually the people who are generally older, perhaps overweight or obese, with chronic conditions such as hypertension, diabetes, or cardiovascular problems. Now, in fact, when we start to think about building greater resilience in the population against future pandemics, it is now strikingly clear that this definition of resilience must include keeping our population as healthy as possible, so that should there be a next outbreak that happens and people get infected, their risk of disease and death is actually as low as possible because they are mostly free from chronic conditions. And this is why today's topic is especially important, because there's hardly any risk factor that singularly has the kind of impact on the health of a person as that of smoking and tobacco use. And there are also few topics in public health which face the same intense lobbying by international players and by the industry, where governments tolerate a series of products that knowingly harm the people, albeit with great reluctance, and also governments put in place a strong degree of control and enforcement. But increasingly, there are governments of a few selected countries who are standing up and saying, no longer will we tolerate such products that harm our people. That actions are currently taken or will be taken with a long-term vision in mind to create a future where people will no longer have to live with the problem of smoking, of second-hand smoke from neighbors and colleagues, and where children will grow up in smoke-free environments or even smoke-free countries. And this is a vision that I personally subscribe to, a future which I hope my children and their children would actually see in their lifetime. But with all public health policies, it is never just the vision, because there is very much so the implementation and also the enforcement that matters. So the journey towards a smoke-free future will certainly not be an easy one, and definitely not one where everyone in the population or every corporation in society will align to freely and wholeheartedly. And this is why today we have the privilege of hearing from Minister Verrall on New Zealand's action plan to be smoke-free. And together with Minister, we also have with us today a highly distinguished and definitely well-informed panel to explore the vision and the challenges of a smoke-free future. Certainly, I hope today's discussion will provide us with a glimpse of where Singapore and other countries can proceed in terms of our long-term vision towards smoking and tobacco use. So Hsien, to our moderator, no stress at all, but that's something that we hope you will be able to moderate out of our panel. And with this, let me welcome all of you again to today's Public Health Thought Leadership Dialogue, and to wish everyone an insightful hour ahead. And if I may, it is now my privilege to welcome our friend and our very distinguished speaker for today, the Honourable Dr. Ayesha Verrall, for her keynote address on creating a smoke-free future. Minister, please.
Well, kia ora koutou, and I am delighted to receive an invitation to speak with you today. Thank you very much, Prof Teo, for your warm introduction, and also the opportunity to reconnect with friends at the School of Public Health. As you noted, I was lucky to have time at NUS as part of my education as an infectious diseases specialist, where I did my fellowship. And so when I was called into government to be part of our COVID-19 response, those connections with NUS were incredibly important to us in New Zealand, and experts such as Professor Cook, who I know is one of your faculty, were available to us to talk through our response. And I think those sorts of bonds are incredibly helpful to us, and I'm just so pleased to reflect that between New Zealand and Singapore, we did an incredible job in terms of protecting the health of our people and the well-being of our countries, and no doubt due to the important contribution of science to our policy and operational response. It's been a long time since I've had the privilege of coming back to Singapore because, as has been noted, we weren't able to travel so much during the pandemic. So it's just great to be open again and to be here in my capacity as, yes, Minister of COVID Response, but also research, science and innovation, thinking about how we build those bridges that allow knowledge to flow back and forth between our two countries again. So thank you very much for the invitation. We want to create generational change, and that means leaving a legacy of creating a better future for our youth. By going smoke-free, our young people will enjoy more quality years with their parents and grandparents. We will reduce the number of high-risk pregnancies. Strong and healthy babies will be born at term. Fewer people will be in hospital with smoking-related illnesses, and people will have more money to spend on the things they want and need. New Zealand has been on a path towards our goal of becoming smoke-free by 2025. And the foundation of this journey has its roots in our first tobacco control legislation, the Smoke-Free Environments Act 1990. This legislation was led by our former Prime Minister, Helen Clark, and she was also the former administrator of the UN Development Programme. That legislation banned smoking in offices, ended tobacco sponsorship, and banned the sale of cigarettes to people under the age of 16, which was later raised to 18. It was world-leading legislation back then and fiercely opposed by the tobacco industry. But as is so often the case when it comes to making progressive change, it is now hard to imagine life in New Zealand without these laws. Since then, the excise tax on tobacco has been raised progressively, advertising and product packaging restrictions have been introduced, and smoke-free areas have been written into law. So in 2011, as a response to the recommendations from Parliament's Māori Affairs Select Committee, the New Zealand government set a goal to be smoke-free by 2025. The committee held public hearings up and down the country and heard about the heartbreaking consequences of smoking for Māori. And you can imagine, for a population who was introduced to tobacco through colonisation, the ability to say that they wanted a future free of tobacco, where they could continue to have healthy elders and babies be part of their population, was incredibly important. We have made progress on our goal. Currently, 9.4% of adults are daily smokers, down from 18.4% in 2007. Among youth, it's just 1.1% of 15 to 17-year-olds are smoking each day, a substantial drop compared to 2007, where the number was 14%. However, smoking still is the leading cause of preventable death in New Zealand, killing approximately 4,500 to 5,000 people a year, equivalent to about 15% of all deaths. Sadly, as smoking rates have declined, inequities within our population have become more pronounced. Smoking is particularly prevalent in Māori, Pacific Island, and low-income communities. Māori are 3 times more likely to smoke, to be daily smokers than non-Māori, and young Māori females have the highest rate of daily smoking across all youth. In terms of the impact of smoking-related cancer statistics, I can tell you that lung cancer is a leading cause of death for Māori and for Māori women, and the second leading cause of death for Māori men. Increasing taxes on tobacco has reduced smoking rates. However, it appears that the measures addressing influences on individual behaviour, such as advertising or price increases, have not been as effective as intended for Māori, Pacific, and people or the poor. And it suggests that those with the least power in our society find it hard to adapt and quit what is a very addictive substance. So that means, as a percentage, the New Zealand European population is likely to achieve smoke-free status by 2025, defined as less than 5% of adults being daily smokers. But Māori won't reach this goal for decades. This isn't acceptable. New Zealand's founding document, the Treaty of Waitangi, requires the government to take, to the fullest extent practicable, action to achieve equitable health outcomes for Māori. That's why, last December, I launched our action plan to support our goal of being smoke-free by 2025. This means reducing daily smoking to less than 5% for all population groups by 2025. Now, if we are to do this, we will need to be ambitious. We have actions across the areas of legislation, health promotion, stop smoking services, and all of them are underpinned by Māori leadership. We know that it would be impossible to reach our smoke-free goal if we don't change things now, and our modelling tells us that. So we need to take further legal reform and to end the grip of tobacco on our communities. So I have an amendment bill before Parliament, the Smoke-Free Environments and Regulated Smoked Tobacco Amendment Bill, and it proposes significantly reduced retail availability, reducing the appeal and addictiveness of smoked tobacco products, and a smoke-free generation policy. With respect to retail availability, we estimate more than 6,000 retailers sell smoked tobacco products. We will reduce that number significantly, perhaps to a tenth of what it is. This will stop the clustering of retail outlets in highly deprived neighbourhoods, because we know that outlet density undermines a smoker's efforts to quit. We will address the addictiveness of cigarettes by reducing nicotine to very low levels. Multiple studies and clinical trials already show that reducing nicotine to 90 or 95% increases quit rates without the compensatory effect of smoking to make up for the lack of nicotine. Our smoke-free generation policy prohibits the sale, delivery and supply of smoked tobacco products to anyone born from 1 January 2009. And I know that Singaporeans leaders have been instrumental in the development of this policy that we aim to implement. The object of this policy is to prevent the youth and future generations from ever taking up smoking. On its own, the policy is modelled to halve the smoking rates, but it's over 10 to 15 years. So while it doesn't play an important part in us achieving our goal of being smoke-free by 2025, it instead consolidates the gains we make through the more immediately effective policies I mentioned earlier, but it also sends a clear message that there is no safe age at which to start smoking. Overall, these proposals enjoy good, strong public support, particularly the smoke-free generations policy. After all, who wants their kids to start smoking? But there are some that argue this is a prohibitionist approach that could have unintended consequences. I don't think they're right. Firstly, there will be no fines or penalties. Firstly, the fines and penalties are on the person who sells the tobacco, not the person who buys it. Secondly, treatment and nicotine replacement are widely available, including the regulated availability of vapes in retail stores. To further these measures means that those who continue to smoke will not be driven into criminal networks to sustain their addiction. To complement these legislative measures, we're also investing in non-legislative supports, including collaboratively designed public health campaigns, and upscaling and extending stop smoking services. That's why the action plan prioritises innovative community action to denormalise smoking. I learnt an important lesson on the benefits of this approach when I visited a Pacific wakaama or canoe sport group. When I think about it, it might be similar to dragon boating with 20 plus people rowing the canoe together. The participants in this group were motivated by the physical activity, being outdoors, social connections, and connection to their Pacific heritage. A participant told me that they found the smoking cessation support delivered in this setting much more suitable rather than the stress and pressure they felt in a traditional clinical smoking cessation services. Creating generational change involves giving communities currently burdened by tobacco an experience of the better smoke-free future is within their reach. And we're making sure that we support these innovative programs in order to do that. So in conclusion, New Zealand's experience during the COVID-19 pandemic has shown what we can do when government leadership mobilises the community around an ambitious public health goal. Communities and local health providers organise to reach underserved communities for vaccination or to provide the social and food support to enable people to isolate. We want their strength, the strength of our communities, to become an enduring part of our public health architecture. Our government will take bold action to protect future generations from the trap of addiction to tobacco and keep our young people free from the harm that's coupled with one of the most deadly products in the world. I'm very proud to be a part of that. I wish you all well. It's your smoke-free journey, and we'll be following Singapore's progress with interest. Thank you very much for your time, and I look forward to our discussion today.
Thank you, Minister Verrall, for sharing your insights on this. Next up is the panel discussion and Q&A session. May I invite Minister Verrall to take your seat on stage, please, together with our panelists, Dr. Yvette van der Eijk, Assistant Professor at NUS Swee Hock School of Public Health, Dr. Derrick Heng, Group Director, Public Health Group at the Ministry of Health, Singapore, Dr. Koong Heng Nung, Founder and Director of Tobacco Free Generation International Limited, and Adjunct Associate Professor at Duke-NUS Medical School. And today's session will be moderated by Dr. Hsien-Hsien, CEO at the American Chamber of Commerce. Over to you, Dr. Hsien.
Thank you so much, Minister Verrall. That was an incredible speech, really laid everything out for us. And I want to encourage all of you to use Pigeonhole. And I see there are a few questions here already, and I'm going to prioritize questions from the audience rather than me having a one-way dialogue with our amazing panelists. And you notice there are 2 mics also in the room. So if you'd like to ask a question in person rather than using the app, I would also highly encourage it. Some of you may remember that I'm an epidemiologist by training, so I want to take you back to a little bit of a history of tobacco control because it is important for us to realize that there have been many efforts over the decades, but really the most effort has actually been in the last 20 or so years. And in a paper that examines the history of the tobacco industry and the link to lung cancer, Dr. Robert Proctor from Stanford University says, "The cigarette is the deadliest artifact in the history of human civilization." Now, keeping in mind that human civilization actually hasn't been around that long, so it's a bit of a blip, but yet that it is the deadliest artifact. And as epidemiologists, how many of you here, and I asked this last time, are epidemiologists? Good, raise your hand out high, right? You know, understanding the link between tobacco and lung cancer really started with epidemiology. So we should be very proud that the public health discipline is the reason why we have made so much progress today. It started with case control studies, cohort studies, went on to animal studies, then cellular pathology to really get at those cells and see what's happening, and finally the identification of cancer-causing chemicals. So you can see that we are now in an era where we know what is happening both on the epidemiology side and on the physiology side. So now it's up to policymakers and those of us driving change and advocacy to really make this happen. So thanks for indulging me on the history. I think it's important for us to know where we stand in the history of human civilization. And so let's take a look at the questions that you've already submitted. The top question, Dr. Heng, currently is for you. And there's a bit of history there too, so thank you for the person who put in this question. In 1986, the Ministry of Health in Singapore set the goal of going towards a nation of non-smokers. So the question is, how is Singapore going to get to this nation of non-smokers? How do we get to this end game? What's your reaction to hearing what New Zealand's going to do? Were there cheers in the room like, yes, we can do this?
So I think I reflect on Her Excellency's talk today, and I think we all share the same goals, right, in terms of getting to as low smoking prevalence as possible. Right, and I think we have come a long way. Right, so in the 1980s, the smoking prevalence was 19%, 20%. We have half the smoking prevalence. Right. Of course, the question is whether we have done it faster. Right. We have put in a lot of measures along the way, right, including public education campaigns, tax increases, right, and lately, in the past few years, we have implemented standardized packaging. We have raised the minimum legal age for tobacco to 21 years. We have implemented the point-of-sale display ban. And of course, this is complemented by all the other ongoing enforcement, right, of smoke-free laws, facilities to encourage cessation and all that. So it's smoking control, I think, as everyone will acknowledge, is multi-pronged. And we have, along the way, we have actually been quite happy and, in fact, quite keen to learn from best practices elsewhere in the world. So standardized packaging, for example, we learned from Australia, together with other pioneers, including New Zealand. Right? For the minimum legal age, while the US was not a pioneer, I think there was a very influential report by the US Institute of Medicine on the impact of smoking on young minds, and the impact of increased addictiveness and harm when people pick up smoking at a very young age, or pick up nicotine at a very young age. And those are things that we took on board as we formulated our policies. And for point-of-sale display ban, we actually learned from Thailand, who was a pioneer, right, in implementing the point-of-sale display ban. And similarly, I think I really look forward to New Zealand's sort of efforts. And in fact, those are the three ideas that Her Excellency cited are ones that I think we'll be very keen to study. So one, of course, is looking at reduction of retail outlets. The question in my mind, of course, as a practicing sort of policy implementer, okay, is how do you allocate the retail licenses? Do you put it up for bidding like COEs? Right? How often do you renew the licenses? Right? So those are some of the things that I think where there's a practical solution and able to adapt to local context, I think we're very happy, right, to learn and to pick it up and to put it in place locally. Similarly, I think for very low nicotine content cigarettes, I think this is an idea that I think was suggested in the US as well many years back. We've been looking at the evolution, but I think, again, we are quite keen to learn about technical details of implementation. And similarly, I think for the smoke-free generation, right, conceptually, I think the idea is a very attractive one. Right? It will, at a minimum, similar to the minimum legal age, reduce access to tobacco products. But again, we are looking to New Zealand experience in terms of the pragmatic implementation. Questions come to mind, for example, in about 20 years' time, what happens when a 35-year-old tourist arrives in New Zealand? Would you allow the person to buy cigarettes? Similarly, I think in terms of supply as well, I think penalizing the retailer for selling, I think is a sound move and it's a minimum move. The question, of course, is do you penalize other people, right, who buy tobacco and supply it to the smoke-free generation on their behalf? And if we don't, then I think we need to manage public expectations, right? That it is not an absolutist policy, right, but more a policy to incrementally reduce access to tobacco, which I think over the long term will produce results. Right? So I think Singapore studies these policies very carefully, and we're quite prepared to look at the ones that we think will work in our context and to implement them.
So, Dr. Koong, you wanted to respond?
Yeah.
Thank you so much, Dr. Heng.
Yeah, I think
I think I should respond at this point to some of the points Dr. Heng has raised. And the first being the concern about how it can be circumvented by someone who is born before a certain birth year, passing on the cigarette to someone that's after. I mean, the issue was raised in Singapore Parliament in 2016, and the same argument was placed forward. Everybody seemingly accepted the answer. But no one asked the question, does the same problem prevail with the current underage minimum age law? You see, so that alone cannot be used to be against tobacco-free generation. I think that hopefully that will help address that concern. Another item that I'd like to raise will be how there is also some mention about tobacco-free generation takes a longer time to implement or to be effective. But I think if you start seeing how we have done it in engaging the young people, making sure that they are on board on this, and every single member of the tobacco-free generation supports the concept, knowing that they are being protected more than being prohibited. I think you have an immense support. In fact, I often say that engaging the young, engaging the public is our best defense against the industry. And it's also our best offense, because no industry will dare to come on board anymore because you have massive support from young people. Even politicians will enjoy this, because in the Philippines, when they have events, they bring together 3,000 youth, 10,000 youth together, and politicians will say, hey, I want to be part of this event. Why? Because it brings people together. In contrast to current measures, which are prohibitive against smokers, it divides society. So hopefully you can now see tobacco-free generation eliminates that social divide into a societal unite. You see, I think that's the beauty of it. Thank you.
Thank you, Dr. Koong. I think we're talking a lot about the positive things that we're doing, but as protectors of the public health, clearly that is our role, but we are not in this ecosystem alone. And that's where I want to turn to Dr. van der Eijk, because your scholarship in the tobacco industry tactics is tremendous. I was looking at your publications list, so you really have deep insight, because as protectors of public health, we also need to understand what tactics others are using to undermine the efforts.
Yeah, so I think in general, anytime there's any kind of tobacco measure that is likely to work, whether it be a tax or a tobacco-free generation, there's going to be industry response, right? There's going to be some kind of vigorous industry response. And oftentimes, this industry response is kind of silent, so it's not really coming directly from the tobacco companies per se. It's coming from, the retailer associations. It's coming from the lawyers, from the consultants. Yeah, so it's important for us to be aware of that and for us to be prepared for this kind of thing. And I guess the pushback that's been experienced in different countries is going to be different. I heard from Malaysia last week. They were supposed to table tobacco-free generation proposal in Malaysia, right? And they got a lot of pushback from the vaping industry. There was a lot of arguments to say, like, okay, they should legalize vaping for this younger generation, that this tobacco-free generation law should not cover, because it was going to include vaping ban as well as a cigarette ban for the younger generation, and they said that was wrong. And then their reasoning was that, well, if these young people are never going to be allowed to smoke, why should they be allowed to vape if the whole point of them is to stop smoking? Yeah, but then there was a lot of pushback. So I think this is something that we would have to be prepared for, so I think in general it's important to be aware that, first of all, that all of this pushback is coming mainly from tobacco industry, that it's not necessarily grassroots, right? And second, to come with good counter arguments to be able to prepare for whatever arguments that they bring forth. For example, one that I heard, I think this was also raised in Tasmania, right, when they were pushing for tobacco-free generation in Tasmania, was this issue of equity, right? That it's going to affect people who are poor, like racial minorities and whatnot. And I guess in New Zealand, this has been a theme. Whereas actually, when you look at the data, they are the ones who stand to benefit the most from these kind of policies. Yeah, so just to really be aware of all of these arguments.
Especially now with social media, yeah?
Yes.
So I see some young folks in the room. Social media is highly influencing our youth. That's something I know Dr. Koong is. Just 1 second, Dr. Koong, because I really want to get to Minister Verrall, because Dr. van der Eijk mentioned vaping, and there are a few questions about the role of vaping. And how does that compare to actually tobacco-free generation? Then there's cigarettes and there's vaping. How's New Zealand approaching vaping?
Thank you. It's a very tricky problem that consumes a lot of concern for our community. I think if I was to say at a highest level, our principle is one of having risk proportionate regulation. So as has been noted, tobacco is the leading cause of preventable cause of death in New Zealand, and I'm advised that the harms of vaping is not anywhere near the harms of tobacco. I don't like to see young people vaping, but it is not the same as them starting smoking. So in our last term of government, 2017 to 2020, vapes had been in the country for over 5 years by then. We brought in regulation that was sales have to be to people over the age of 18. If flavours, which we believe are designed to capture the youth market, are to be sold, they're only to be in specialist stores. Limits on advertising, can't vape in school, can't vape in cars. Nonetheless, our rates of vaping for youth are between 10 and 20%, and as I mentioned in my earlier remarks, very low rates of smoking. So we think people are starting vaping as a primary habit. We think vaping should be there to support people to quit, and that's the space it should occupy. And while we've had regulated vapes, we have made substantial progress. In the last year alone, we had a 2% reduction in smoking without changes in excise tax or other regulatory measures. So we feel it does have a place. However, we know we need to recalibrate to make sure that it is in that place of being a quit tool and not so much on the as a primary addiction for young people, which we want to avoid.
Dr. Heng, did you want to add anything on the vaping front? Quite controversial in Singapore, from what I understand.
Yeah, sure. I think even the most ardent advocates of vaping will agree, right, that actually you don't want the youth to take up vaping. I think everyone agrees on that. And I think that's where Singapore places its focus. So I think policies are country-specific, right, in terms of the context. So we're fortunate in the sense that we had a ban on vaping right from the beginning, right? So it was never allowed to become entrenched here. Sure, you see people vaping here, right, but it's not entrenched, right, as it would have it had been a legal product. So people often say, why are cigarettes a legal product? Right? And if they had a new product now, they would never have been allowed on the market. Right? So I think we have taken the argument to apply to vape products and new products. And we say that yes, actually it's a very sound argument. Okay, let's not allow them on the market, right, in the first place. Of course, it's not without challenges. Right? In a world where vapes are available, elsewhere, right? There's a constant challenge to control, right? Importation and smuggling, right? In that sense. Right? Similarly, I think along the same veins, I think we are not against sort of prohibitionist sort of policies. Right? So for youth smoking, for example, actually, if you supply cigarettes to somebody under the age of 21 in Singapore, we would penalize you. And I think there will be strong public support for us to do so. Right. The question, of course, is, and I have an open mind, the question is whether if we do tobacco-free, whether in 20 years' time, if you go after a 45-year-old for supplying cigarettes to a 40-year-old, whether there will be the same degree of support. And I have an open mind on that. So those are some of the considerations. Right. I believe that in New Zealand's case, they are not proposing to penalize. So basically, it's solely a retail measure. Right? And the recognition that if you're a retail measure, then by design, there will be loopholes, and we live with it because we have recognized that in the longer term, it will have an impact. Right? And that must be a realistic sort of assessment, a realistic way of selling the policy to the population so they don't set out unrealistic expectations. And I certainly agree that it's actually a very good rallying cry, right, to mobilize youth around. Right? And that's something that I think is very worthy, so to speak. Yeah.
So now for you, Dr. Koong, because you're all about mobilizing youth. I think you had a comment about tobacco industry, but I also want you to speak to how are you educating the youth on the difference between cigarettes and vaping and tobacco? Because I think education is a huge part of what you do, right?
Yes. So I encourage and support some of the youth in the audience to maybe say a few words on how this is different from the one you have experienced under the tobacco-free generation workshop that I've conducted to you. In the meantime, while you prepare your segment, just want to address a few things. Firstly, thanks for bringing up Malaysia and Tasmania. I think the key point here is that both Tasmania came to learn from us in 2013, 2014 to attend a workshop that I conducted. We shared our experience, and then it was brought back and was raised very quickly to Parliament and announced. The same thing happened in Malaysia, where it was very quickly raised and discussed in Parliament. And how much education can you get through a short parliamentary speech? In the absence of a public education that is massive across the entire society, if you don't prepare your ground well, just the same as how we have so successfully overcome COVID because we prepared our people well, there is massive adoption. The same as if you have reached out in Singapore's context, we have 38,000 births per year. If we can reach out to 38,000 per year, and this cohort can completely understand now through better education why we have been failed in our earlier, not the strongest, not the best policy, but now they have a better policy that protects them. That whole cohort will embrace it. You will now have 0 smokers or 0 vapors. That means there's no more demand, and you don't even have to worry at 25 years old or 46-year-old, you don't even have to identify the issue anymore. Tasmania and Malaysia went wrong because, in fact, I told the Minister of Tasmania, I wrote to him, I said, I'm happy to help you mobilize entire society to get your undergraduate and your postgraduate to be aware of what tobacco-free generation is all about first. They are the people who can then send out beautiful social media messages that shows positive population responses to it. And once you have such positive responses, you will deter the industry. In fact, if there is such positive responses, industry, you will start realizing if it's so logical, and yet a politician or leader doesn't support it, we better start thinking about what's influencing this politician in making that inappropriate decision. So you see how the notion of tobacco-free generation then completely turns the entire conundrum of tobacco prevention that we've been facing for decades now, because you convert something that's completely always negative, prohibitive, to something that's social movement, that is positive, energizing, you see. So I think that's our best approach from my perspective. Thank you.
Thank you very much. Feel free to use the mics, you see them, right? It's okay to ask a question in person too. But another group of questions in Pigeonhole has to do with equity. So I thought we should get to that because I don't know enough, and I'm also very curious. On the equity front, how does the approach have to be different, say for the Maori? How does the messaging have to be different? Tell us more about what you're doing with the Maori population.
Thank you. And I think it's such an interesting observation that our previous policies exacerbated inequities. And I hypothesised in my speech that that's because people at the lower end of the income spectrum, people who are excluded, have fewer choice. But I guess that's also a question for experts to explore further whether or not that's the case. I think at a policy level, the most important thing is sharing decision making in our public health approach. So while I'm taking these laws through Parliament, we have a Māori task force which is overseeing our public health work in quit smoking, and many of the community partners that we engage, Māori-led health organisations, Some of them have been keeping the fires burning in tobacco control in New Zealand when government wasn't doing so much. It's wonderful to be able to go to those organisations and say, government has your back and we're going to do the regulatory changes so you can continue the community level work. It's hard to describe what we saw in COVID, but our community organisations have a certain magic. And one day, drawing on our community organisations, we vaccinated 2% of our population. With mostly, I think, getting people's aunties and pastors and football coaches to go out and tell them, you better get vaccinated now. So how do we mobilise that force for tobacco control? Clearly working with Māori and Pacific organisations and empowering them to find solutions in their communities is a big part of that. But obviously government has to make sure there's that regulatory backup so that the environment doesn't allow tobacco industry to continue to control those populations.
That makes a lot of sense because we know people need to take ownership over their own health and to be an active participant. Dr. Koong, you first, but you next, but also I wanted to ask Dr. van der Eijk her insights on equity, because you had mentioned it earlier, right?
So the beauty of getting the young involved is that they are very good at video making nowadays, right?
That's a tactic.
They will make beautiful videos with great entertainment, with the appropriate music that draws in not just the intellectual connection, but the emotional connection. They use the common, their generation language lingo. You make that immediate connection and you get massive support. Activate your young people, your Maori youth, because they will then create videos that conjures up the nationalistic spirit, the can-do spirit. And once you do that, again, it deters the tobacco industry. For example, the one that we did in Philippines was because in Balanga City, Philippines, that was the fall of democracy during World War II, because that was the last bastion of democracy in World War II. And because we started Tobacco-Free Generation in the same province, the title of the video was called Rise at Bataan. It was the rise of a greater community now against a greater pandemic that's killing even more than World War II. You see that? Just the title alone is inspiring. You see, you need catchphrases like this that inspires the young. And once you inspire young, it will just snowball on its own. So thank you for the opportunity.
Well, I want to emphasize that videos are just a tactic, right? I think what you're saying that's important is activating the youth. However they want to do it. They want to gather and have a musical concert. They want to gather and put on theater. Video is one conduit, right? Yeah. Dr. van der Eijk, what do you think about equity?
Yes, on the note of equity, I mean, one thing about Tobacco-Free Generation is it targets young people, only younger generations, right? And I think actually one important point that we cannot ignore is that we have to also target the current smokers. Because when you look at, long-term projections of the impact of this kind of policy, and they've done several simulations of this in New Zealand and US, we've done one for Singapore, and we actually see that, yes, it does get rid of smoking, but it takes 4 decades. That's too long, right? I'm going to be retired by then. I need it to go faster. So we need to have measures that also target current smokers. So, like with New Zealand, right, removing nicotine from cigarettes, that's one way of doing it. And we know that this will get rid of smoking pretty quickly because current smokers will respond to that, right? If there's no nicotine, they will quit, quite simple, right? And also reducing the volume of retailers and taxation and other ongoing policies. So this is very necessary, and I think that's also very important when we think about equity, right? Because if you leave alone those current smokers, then they get ignored too, and then their needs get lost in policies. And then there's also this danger that we think, oh, okay, we've solved the problem. We've got this tobacco-free generation proposal, so now we can think of other things. But there's still going to be a huge public health impact for several decades, right, before the real effects of tobacco-free generation kick in. Yeah.
It does seem like it's going to take a while, but I think we can accelerate it with the joint force of people in this room and beyond, right? There's a good question here about unintended consequences, because as we know, the world, the systems work, it's homeostasis, you tweak one thing, something else changes, what the heck happened here? So in thinking about that, in terms of unintended consequences, I'm actually going to ask each of the panelists to share. Have you looked around the corner or from past experience, know that there are some things that we need to mitigate risk or something that we need to take into account because it might just happen? No, could we start with Minister?
Yeah, thank you. I think that's the point I addressed in those points about prohibition. When part of our public discourse on tobacco control in New Zealand is a part of the wider discourse about decriminalisation of drugs, which we haven't taken a step towards that, but it is a discourse that happens in our community. And that concern in that discourse about prohibition, driving young people into criminal networks by making purchase illegal is a very valid concern. So that's why we are trying to stop the commercial incentive here by prohibiting sales to people in the smoke-free generation and making sure there's a harm minimisation approach of having access to other nicotine. So that's been our approach there. We think that is an important risk to cover off.
Dr. Heng? Any unintended consequences you think we need to be aware of?
I'll pass on this one for now.
Okay. Understood. Dr. Koong?
Well, I don't see any unintended consequences because the sheer fact that you're mobilizing society to support a better public policy will result in resounding support for politicians to make a journey. For example, in Philippines, when we started, 32,000 people got together, signed a petition, asked the local mayor to enact the tobacco-free generation law. We don't put the politicians in the front line. Instead, it's the young people fronting it. Young people like you all, talented undergraduate, postgraduate students who have powerful network with the appropriate language and the beautiful background that can champion for something greater of idealism for the whole society. So I don't really see any impediment. The only thing that probably I think we should be a bit more aware of is that we gradually over time need to take down the minimum legal age law. This law has been universally accepted. The tobacco industry supports this law because this law continues to allow them to conduct their business as usual. This law protects them because they will always, in their interview, say, I am only marketing to adults. When indirectly they know that this sends a rite of passage impact on your future generations. That same law allows them also to take legal action against governments because the law allows them to continue practicing. So over time, I hope people start to realize that tobacco-free generation is more harmonious because it doesn't target smokers anymore, but it sets a new standard to the new generation with a better policy. Without targeting the future, the old, because we accept and acknowledge old policies were made, they apply to the old, earlier cohorts. It's common, that's how we make laws in the first place, grandfathering. Grandfathering is a concept where you make laws that is based on a birth year, it applies to a new cohort. In Singapore, for example, all children born after 1st of January 1996 must have mandatory primary 6 education, 6 years of primary education. Foreign workers, foreign domestic helpers in Singapore must have 1 day off a week from new contracts made from 2018 onwards. Is it the same as any conventional public health policy? It is. It is not rocket science. It's just that no one has actually thought of it to be applied in tobacco control context. So it is harmonious, but we need to take down the minimum legal age. And if you ask yourself, how did this minimum legal age come about? I think it's just a very simplistic concept that came about because they started to understand that we need to protect children from harms of cigarette. What is your definition of children? Below a certain age. I think it's as simple as that there was not in-depth thinking process behind to recognize the collateral damage. Yeah.
We have one question on the floor. Identify yourself and ask your question, okay?
Hi, I'm Sarah. I'm not a public health practitioner, but I think that perhaps there might be a need to reframe the entire argument. And I'm speaking on behalf of non-smokers, passive smokers, and also talking about public discourse and protection, which is what we are supposed to be doing. So I was wondering if we need to redefine what constitutes smoking and to count the mental health effects on non-smokers, on passive smokers. The problem with Singapore is that the Health Promotion Board has done a great job in telling us that cigarette smoking kills. Because of that, when we are stuck at home, it's talking about smoking at balconies and windows, right? Hot topic right now. When we're trapped at home, getting smoked twice an hour for 7 hours until 12 midnight, or etc., you get stressed. The mental health issues are chronic, long-term, and immediate. It is a disability that negatively impacts productivity, read economic losses, and causes physical ailments like insomnia, anxiety, and even worse. So perhaps this disability should count against what we call disability-adjusted life years. And if the smoke doesn't kill you, the stress might. So doing nothing might not be an economic option. So the extent of all-round health effects on passive smokers perhaps should be given greater emphasis in the conversation, and considering we are the majority, not just as a bullet point amid the glowing charts that say that, smoker rates have reduced, and therefore give the illusion that everything is all well. For change to come, perhaps the narrative has to change. As such, and also the main actors must shift, and the words attached to passive smokers to include immediate, chronic, disability. So we can't say that surveillance technology is not there because you can make batteries recharge from air.
Sarah, do you have a question?
Yes.
Because I'm about to ask you for your list of references.
Me. So I want to know what is the situation right now as in stopping any bylaws for stopping smoking at balconies and windows, and from your neighbors from emitting cigarette smoke, because it has worked. Private estates have done bylaws, and they have. But then again, it also raises the question of a socio-economic fairness of giving hope to the abuse, because that is only for private estates. Thank you very much.
Thanks, Sarah.
I guess I
yes,
can
Dr. Van der Eijk, take it on.
Yeah, so I guess, in the context of what we're discussing, right? Tobacco-free generation, tobacco endgame measures. Yes, I think it's important to keep paying attention to these issues like secondhand smoke exposure, because even as smoking rates go down slowly towards the endgame target, people still get exposed. And in countries like this, where everyone lives closely packed together, if one person's smoking in their home, it's going to expose a lot of people around them. So it's very hard to avoid, even in public places or in your home. Yeah, so I think it's just really about paying attention to these issues on an ongoing basis and always revising these smoke-free legislations and thinking about, is there any kind of mechanisms for people to create smoke-free homes? Is there any way it can be easier? And I know that in some other countries, like the United States, smoking is actually banned inside public multi-unit housing run by the HUD, Housing Urban Development Board. And in other countries have actually revised their laws such that it's easier for private condos, for example, to set their own bylaws and their own smoke-free rules. Yeah, so this is something that could be looked into here as well, I guess.
Do our panelists have any parting words before I close out the session? Okay. Thank you so much, Minister Verrall, for your time and your sharing today. Dr. Heng and Dr. Van der Eijk and Dr. Koong, let's put our hands together for a round of applause and appreciation. And let's work together towards a tobacco-free generation. Thank you.
Thank you for the insightful discussion. Before we wrap up, I'd like to invite Prof. Teo to present a token of appreciation to our panelists. Dr. Yvette van der Eijk. Dr. Derrick Heng. Dr. Koong Heng Nung. And Dr. Hsien-Hsien. Finally, Prof. Teo will be presenting a token of appreciation to Minister Verrall. This calligraphy scroll is a replica of the memento presented to our school's benefactor, the late Professor Swee Hock, when the school was established in 2011. Ladies and gentlemen, the Chinese characters on the scroll, when read from your right to left, mean health for all, underlying the school's commitment to turn discovery into healthier communities. These very same characters, when read from your left to right, mean all for health, highlighting how good health provides a critical foundation for a strong population. Thank you, Minister Verrall, Prof. Teo, Dr. Eijk, Dr. Koong, Dr. Heng, and Dr. Lei.